Tay Sachs disease is a rare genetic disorder that is passed from parents to their children. This disease is a mutation or deficiency in the enzyme hexosaminidase A, which is located in the lysosomes, and what this does is it codes proteins that break down lipids or fatty substances. When there is not a normal amount of this enzyme, or if it is mutated, then a specific fatty substance called gangliosides build up to toxic levels in the brain and spinal cord, affecting the function of the nerve cells. Tay Sachs disease can happen during 3 stages of life and are infantile, juvenile, and adult. The stages of life where someone starts expressing this disease is dependent on the amount of residual enzyme activity. Some signs and symptoms of Tay Sachs disease are mostly similar, yet vary bit by bit with the life point in which someone has this disease. Early onset shows symptoms around 6 months of age and includes the loss and no gain of motor nor mental skills that leads to seizures by the age of 2 and early death eventually following. Another symptom during early onset is growth in head size and can be seen in this image here. Juvenile symptoms start around the age of 5 and are less common and include things such as behavioral problems, loss of movement control, and loss of vision with speech. Survival for the juvenile form goes into the teen years. The last form is adult and is the least severe form, with it not always impacting life expectancy. These symptoms progress slowly and include muscle weakness, tremors, loss of ability to walk, and loss of mental function. The treatments for Tay Sachs disease are to primarily manage the symptoms and prevent any complications. These include medication for seizures, antibiotics for respiratory infections, respiratory care to prevent lung infections that cause breathing problems, assistive feeding tubes to prevent respiratory problems, to delay loss of function, occupational therapy to help with daily functioning, and speech-language therapy to assist with swallowing problems. In this first image we have here in the top left is a baby with an assistive feeding tube that goes through the nose, supplying food directly to the stomach. Another example of an assistive feeding tube is one that goes directly into the stomach. In this other image in the bottom left here, we have a person at a physical therapy clinic using parallel bars to support them in walking. The reason for Tay Sachs disease is because it's caused by a mutation in the hex A gene on chromosome 15 that normally codes for the alpha subunit of the hexosaminidase A protein. This hexosaminidase A protein breaks down lipids, fatty acids, in particular GM2, and gangliosides in the nerve cells. When this hex A gene is mutated, it's not able to code for these proteins, and as a result, these gangliosides will build up in the neurons. And the buildup of this is both toxic and eventually leads to cell death. In the image to the left, for the top 2 pictures, we see when there's normal levels amount of this gene, where the neurons are healthy with normal lysosomes. In the bottom is when this gene is mutated, and then the protein is not being able to be coded to be able to break down these gangliosides, which causes inflammation of the neurons in enlarged lysosomes. Some risk factors are having ancestry from certain areas of the world, such as Cajun communities of Louisiana, French-Canadian communities in Quebec, Eastern and Central European Jewish communities, and also another risk factor is having a parent that is a carrier of this hexa A gene change. The ones out of the communities that are especially prominent are in the Jewish communities because it's due to 1 in 27 people carry this gene. So how do you test for and diagnose this disease? The 3 possible ways is by blood testing, genetic testing, and eye exam. For blood testing, you do it to see if you have Tay Sachs disease or even a carrier of the gene mutation, and it also can determine the enzyme activity levels and also test, just like I said, if you're a carrier. Genetic testing is done to see if there is any mutations in the hexa gene that you have, and for eye exam, when looking at your eye, they're going to look for this cherry red spot that is in the bottom left where it's pretty prominent. And in the top left is when someone doesn't have this cherry red spot and are normal for Tay Sachs disease. For the prevention of this disease, what people could do is get genetic testing done, especially before a couple try to conceive a child, and is especially urged for couples that have Jewish ancestry in them, as stated earlier, where 1 in 27 have this disease. And they want to get tested if they are carriers or if they do have it. And if they do, then they have several options such as adoption and even assisted reproduction technologies. For this disease, there really is no cure for it, but there are ways and treatments that can help manage symptoms, just as stated earlier.